Good morning. Welcome to St. Xavier University Hospital. I'm your nurse, Nikita, and I'm here to briefly explain to you why you may need to undergo a cardiac stress test. There can be many reasons, such as you are exhibiting symptoms, or perhaps you may need it to make sure that the heart is capable of handling a major surgery. We also would need to evaluate your myocardial perfusion. That means to see if your heart is being oxygenated properly. You as the patient may have undergone a bypass surgery or had a balloon pump inserted, which is a procedure to open up blocked coronary arteries. The stress test is a way to determine if those procedures have improved coronary blood flow. Also, perhaps you need a diagnosis or treatment of exercise-induced arrhythmias. Arrhythmias is simply an irregular heartbeat. So you as a patient may have had an irregular heartbeat only on exertion, which means if you're moving around. The stress test is a safe way to induce those arrhythmias in a controlled environment so that they can be identified and treated right away. Also, perhaps follow-up to a cardiac rehabilitation is needed. The post-MI or heart attack may have gradually worked up to more normal exercise levels. The stress test helps to determine if your heart is tolerating this induced increased exertion. Lastly, we may need to evaluate if the drugs or medications that you're on are working properly. Family history of heart disease perhaps will cause you to need a cardiac stress test.